As you probably already know, Medicare's annual enrollment period is coming up soon, and with that comes a whole new set of updates and changes for the year 2026. Every year, we see small shifts in premiums, deductibles, and prescription drug costs, but this year's adjustments are particularly important because they'll directly impact your monthly budget and healthcare planning. In this video, we'll go over everything you need to know about the 2026 Medicare changes, the good, the bad, and what you can do right now to prepare yourself for the new costs and coverage updates coming your way. Let's start with one of the most important and universal parts of Medicare, the Part B premium. For most people, this is the amount that gets deducted from their Social Security check or that they pay directly to Social Security each quarter. In 2025, the average monthly Part B premium was $185, but for 2026, that number is going up to $206.50 per month. That's about an 11.6% increase, which is quite significant. When you think about it on a yearly basis, that adds up to more than $250 in additional costs each year, just for your Part B coverage. For many retirees and people on fixed incomes, that's a noticeable hit. The reason for this increase isn't random. Medicare premiums are closely tied to inflation, especially healthcare inflation, which tends to rise faster than general inflation. The costs of hospitals, doctors, specialists, and medical equipment continue to grow every year, and Medicare adjusts these premiums to make sure the system can sustain itself and continue covering services effectively. While nobody enjoys paying higher premiums, these adjustments ensure that Medicare continues to deliver quality coverage and keep up with medical cost trends. It's also worth remembering that your Part B premium is income-based, which means it's calculated using your income from 2 years ago. So, for 2026, Medicare will look at your 2024 income. If your income has dropped significantly since then, maybe you've retired, experienced a major life event, or simply have less taxable income, you can file an appeal to have your premium reduced. This process is called an IRMAA appeal, which stands for Income-Related Monthly Adjustment Amount. Many people aren't aware of this, but if your income situation has changed, you don't necessarily have to keep paying the higher rate. Appealing your IRMAA determination can help you save quite a bit of money in 2026. Now, let's talk about the Part B deductible. This is another important cost that affects millions of Medicare beneficiaries. The deductible is what you pay out of pocket each year before Medicare starts covering your outpatient care, things like doctor visits, lab tests, and physical therapy. In 2025, the deductible was $257, but in 2026, it's increasing to $288 per year. That might not sound like a huge jump, but for people who have original Medicare paired with a Medigap plan, especially Plan G or similar, it's an amount they'll definitely feel, since you have to meet that deductible before your supplemental plan kicks in to cover the rest. The increase is a reminder that healthcare costs continue to rise, and that planning ahead for these small but consistent adjustments is crucial. Even though it's only a $31 increase, it still affects everyone on Medicare who doesn't have a plan that fully covers the deductible. For many, it's an out-of-pocket cost that happens early in the year when you visit your primary care doctor or specialist. Now, moving on to prescription drug coverage, which is one of the biggest parts of Medicare and often the most confusing. In 2026, we're seeing some significant updates to Part D, and these changes are part of a larger effort to make prescription drugs more affordable in the long run. But for now, let's focus on the key numbers. The Part D out-of-pocket drug cap, the maximum amount you could pay in a year before catastrophic coverage kicks in, is increasing from $2,000 in 2025 to $2,100 in 2026. This means that people who take a lot of expensive medications will have to spend a little bit more before reaching that limit where Medicare provides more relief on drug costs. The Part D deductible, which is the amount you pay before your plan starts covering medications, is also going up. In 2025, it was $590, but in 2026 it will be $615. That's a $25 increase. This deductible applies mainly to higher-tier medications, things like brand-name drugs or specialty prescriptions, while many generic drugs often aren't subject to this deductible. Still, for anyone who takes higher-cost medications, this change can mean higher out-of-pocket costs early in the year. There's some good news, though. Insulin will continue to be capped at $35 per month, regardless of your plan, and vaccines recommended by the Advisory Committee on Immunization Practices will continue to have $0 copays. That means vaccines like shingles, flu, pneumonia, and others approved under Medicare Part D will be available to you at no cost. These are small but meaningful wins for beneficiaries who rely on preventive care and need consistent access to medications like insulin. So, while most of the news so far points toward higher premiums and deductibles, the continued push for drug price caps and free vaccines shows that Medicare is still working toward affordability and accessibility for essential treatments. Another important point to keep in mind is how these changes affect your overall budget and planning for next year. When you combine the increase in the Part B premium, the deductible adjustments, and the slight bump in drug costs, your total healthcare expenses could be several $100s higher than last year. That's why it's important to review your coverage during the annual enrollment period and see if your current plan is still the best fit for your needs and budget. This is also the perfect time to compare your prescription drug plan with others in your area. Even a small change in your medication list or a new deductible structure can mean a difference of hundreds of dollars a year. Reviewing your Part D plan every year helps you make sure you're getting the best value possible. For anyone new to Medicare or approaching 65, it's a good idea to understand how these annual updates work. Every year, Medicare reviews the cost of providing healthcare to beneficiaries and adjusts premiums and deductibles accordingly. These adjustments aren't random, they're tied to medical cost growth, usage patterns, and inflation in the healthcare sector. So when you see an increase like the one we're talking about for 2026, it's part of an ongoing effort to balance the costs of the program while maintaining its benefits. If you're on a tight budget, consider setting aside a little extra each month starting now to prepare for these new rates. An increase from $185 to $206.50 per month might not seem overwhelming, but for someone on Social Security, it can reduce the amount you receive each month by about $20. Over a year, that adds up, especially when combined with other increases like the deductible and prescription costs. It's also a good idea to review your overall healthcare usage from the past year. How often did you visit your doctor? Did you start any new medications? Have your health needs changed? The more you understand your usage, the better you can predict what your 2026 costs will look like and whether your current Medicare plan is still the right fit. For example, if you're taking more medications than before, you may want to look into a Part D plan with better coverage for your specific drugs. If you're visiting the doctor more frequently, consider the impact of the Part B deductible increase and how it affects your total annual spending. The goal is to avoid surprises when those new costs hit in January. Another thing that's worth mentioning is that the Medicare annual enrollment period, which runs from October 15th to December 7th each year, is your main opportunity to make changes. During this time, you can switch from original Medicare to a Medicare Advantage plan, move from one Advantage plan to another, or change your Part D prescription drug plan. Any changes you make during this window will take effect on January 2026, when these new costs also begin. Even though most people tend to keep the same plan year after year, taking a few minutes to compare your current plan against new options can make a big difference. Plans change their coverage, networks, and formularies every year, so the plan that worked for you in 2025 might not be the most cost-effective option in 2026. It's also helpful to understand that while premiums and deductibles are increasing, there are still plenty of ways to save money on Medicare. For example, using preferred pharmacies, choosing generic drugs, and reviewing plan ratings can all help reduce your total costs. Some Medicare Advantage plans may offer added benefits like dental, vision, hearing coverage that original Medicare doesn't include, and if those benefits align with your needs they could offset some of the cost increases elsewhere. The main takeaway from all of this is preparation. The earlier you review your options, the better positioned you'll be when these new rates and deductibles take effect. Medicare can seem complicated, but the key is to stay informed and proactive. Understanding what's changing helps you avoid unexpected bills and ensures your healthcare coverage continues to meet your needs in 2026. So, to recap the highlights, the Part B premium is increasing from $185 to $206.50 per month. The Part B deductible is rising from $257 to $288. The Part D out-of-pocket cap is going from $2,000 to $2,100. And the Part D deductible is moving from $590 to $615. On the positive side, insulin will remain capped at $35 per month, and most vaccines will continue to be covered with no copay. That's the core of what's changing for Medicare in 2026. While most of the adjustments reflect normal cost of living and inflation-based changes, they're still important to know so you can plan accordingly. Take time during open enrollment to check your coverage, compare your plan options, and make sure you're maximizing your benefits while minimizing your costs. If this video helped you understand what's coming in 2026, make sure to like, share, and subscribe so you can stay up to date as new information is released. Medicare is constantly evolving, and being informed is the best way to protect your wallet and your health. Thank you for watching, and stay tuned for more updates as we get closer to the 2026 enrollment period.